Now look at question 25. You hear a hospital nurse talking to a patient. Now read the question.
Hi there, I'm Dory. I'll be your nurse while you're here at the rehabilitation centre. How are you feeling today?
Okay, just a bit tired after the surgery.
That's understandable. I need to go over the falls policy with you. As you know, falls can be a significant risk for patients, especially after hip replacement surgery like yours. It's important to take precautions to minimise the risk of injury. Are you familiar with the policy?
Well, I know to use the call bell if I need help getting out of bed and to use my frame when I'm walking. I was told to keep my personal belongings within reach and report any spills immediately. What worries me is that I keep coming over dizzy when I go to stand up. I guess I should just keep still and wait till it passes.
You certainly shouldn't try to move. And press your call button if you can, and we'll be straight with you.
Question 26. You hear two community nurses conducting a patient handover. Now read the question.
My main concern is Pavel. He's an 85-year-old male who has a diagnosis of vascular dementia. He lives at home with his wife, Maria. She has her own health problems, but generally seems to manage well, and there's a daughter living locally.
Okay.
Pavel had a significant ischemic stroke 5 years ago, and since then has presented with memory problems and occasional non-distressing hallucinations. He has some expressive dysphasia and dribbling of saliva, for which a speech pathologist offered conservative advice. He also has COPD that he self-manages with inhalers. He was diagnosed with a hydrocele, which presented shortly after his dementia diagnosis and causes him a bit of distress. He keeps forgetting it's there, so you may need to go over with him how to avoid discomfort when sitting down or using the bathroom.
Okay.
Question 27. You hear the beginning of a training session for nurses about to start work on a paediatric ward. Now read the question.
Today, we're talking about how, as nurses, we can support the best resuscitation outcomes in our patients. Now, unlike adult cardiorespiratory arrest, that's mostly caused by ventricular fibrillation, most paediatric cardiorespiratory arrests are secondary arrests caused by hypoxia as a direct result of underlying illness or injury. So, when a child's condition is deteriorating, it's vital to provide airway, breathing, and cardiac support to prevent progression to cardiorespiratory arrest. Having a thorough understanding and knowledge of the equipment on the paediatric emergency trolley means you can select the equipment you need to manage the deteriorating patient in an emergency situation. So that's what we're focusing on in this session. The equipment is stored in an emergency trolley which has specific equipment for either airways, breathing, circulation, or disability stored in each of its 4 drawers.
Question 28. You hear an occupational therapist briefing a trainee about a home visit that is going to observe her making. Now read the question.
OK, so the first patient today is Mrs. Olvera. She's 86 years old and recently widowed. She's finding living alone rather challenging and her function has declined, leaving her with increased anxiety.
I see.
Her son's staying temporarily, but he's due to go home next week. So what we're doing today is trying to increase her confidence when preparing their lunch. We'll get her to gather all the items she needs and set the table, and then supervise her heating the meal, giving as much reassurance as we can.
I see.
If that goes well, then we can move on to the stair lift, because she needs to access upstairs and she's particularly anxious about the controls. This is where the son's rather inclined to take over. That's understandable, but we need him to see that it's better to guide and support her rather than trying to do things for her. But we may not get to that today.
Sure.
Question 29. You hear a hospital pharmacist talking to a patient. Now read the question.
So, how are you getting on with the omeprazole you're taking for your acid reflux?
Well, there's no doubt it does the job. I've hardly been woken up by the reflux at all, unless I forget to take it, of course. It's meant to be an hour before dinner. I don't always manage to stick to that.
Well, to get the full benefit, you do need to take it as directed.
I realise that. The thing that's bothering me actually is that I've read how it can lead to other problems eventually if you're on it too long, like bone fractures, kidney disease, even infections. I'm not keen on that idea.
Well, the benefits definitely outweigh any risks, as long as you don't exceed the recommended dose.
I think I'm more inclined to try and wean myself off it if I can.
I wouldn't advise that, actually. We'll monitor you and adjust it as needed.
Question 30. You hear a primary care doctor talking to a patient. Now read the question.
So how can I help you?
My big toe's very sore, especially if I walk any distance or put my weight on it. I've been taking painkillers and using an ice pack, but it's not getting any better.
I see. Have you ever had any problems like this before?
Well, yes, I had gout a few years ago, but not in this toe. My doctor at the time suggested losing weight and adjusting my diet, which I did, and it cleared up without too much trouble.
Perhaps you've knocked it somehow?
Well, I did trip over a curb last week. It hurt a bit at the time, then I forgot about it. But a couple of days later, this started. Do you think that it's set off the gout again somehow?
It's possible. Is it okay if I examine your toe?
Yes, of course.